Bedwetting is very normal, first of all. Up to about age 7 is where, um, it, after about age 7 is where we start to say it's a little bit less than normal when we look at the spectrum of how many kids are still having bedwetting problems at night. So we start to not really do any interventions until at least age 7 or later. This is something you want to talk to your pediatrician about or your family practice provider about, and kind of determining other questions, because there can be a lot of other confounding factors that contribute to it, like constipation. It's also very familial, so if there's a family history of bedwetting, it's about 40% chance likelihood that your child will also bedwet. And the age that the parent was able to become continent or not have any more bedwetting doesn't always correlate with when the child will as well. There's really some things that can help and be successful, and the most successful is called bedwetting alarms. One brand that I like that I get no endorsements for is called the Wet Stop 3. There's lots of different types, and you can go on, lots of different websites, the bedwetting store, Amazon, many different places where you can buy different varieties, but it's consistency. And if you're using it consistently, it takes about a month or so of it being consistent before you can try to retrain their bladder. So initially they're going to urinate, it will wake them up, then you get up with your child, take them to the bathroom, and put them back to bed. Also, not making a big deal about it like you're already doing can be very helpful, but it slowly, they will have less and less where they're waking up and already being wet, and more waking themselves up. And it can be an exhausting process, but really the key to it being successful is consistency, and you getting up with your child when they urinate, helping them try to completely empty their bladder if they hadn't when they had the accident. Can be most successful. There's medications that you can also use. These have less success long-term wise, but they can be very helpful. I like to use them for like sleepovers and things like that, so the child doesn't feel like they can't go and engage in these activities with their friends because they're afraid they're going to have an accident. And this is, again, something you should talk to your provider about.